A lot of information has been misled in social media about the coronavirus. More risk of handling the deadly virus is when you don't have the right idea of what it is, how to identify the symptoms and how to prevent it. The disease caused by the novel coronavirus, first identified in Wuhan, China, has been named Coronavirus Disease 2019. CO stands for corona, V for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus. The coronavirus is a new virus linked to the same family of viruses as severe acute respiratory syndrome, SARS, and some types of common cold. The coronavirus has been described as a pandemic by the World Health Organization. What does that mean? Characterizing this virus as a pandemic is not an indication that the virus has become deadlier. Rather, it's an acknowledgement of the disease's geographical spreading. 1. How does the COVID-19 virus spread? The virus is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing, and touching surfaces contaminated with the virus. The coronavirus may survive on surfaces for several hours, but simple disinfectants can kill it. 2. Symptoms can include fever, cough and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. These symptoms are similar to the flu, influenza, or the common cold, which are a lot more common than coronavirus. This is why testing is required to confirm if someone has the virus. It's important to remember that key prevention measures are the same: frequent hand washing, and respiratory hygiene, such as cover your cough or sneeze with a flexed elbow or tissue, then throw away the tissue into a closed bin. Also, there is a vaccine for the flu, so remember to keep yourself and your child up to date with vaccinations. 3. Wash your hands frequently using soap and water or an alcohol-based hand rub. Cover mouth and nose with flexed elbow or tissue when coughing or sneezing. Dispose of used tissue immediately. Avoid close contact with anyone who has cold or flu-like symptoms. Seek medical care early if you or your child has a fever, cough, or difficulty breathing. Should I wear a medical mask? The use of a medical mask is advised if you have respiratory symptoms, coughing or sneezing, to protect others. If you don't have any symptoms, then there is no need to wear a mask. If masks are worn, they must be used and disposed of properly to ensure their effectiveness and to avoid any increased risk of transmitting the virus. The use of a mask alone is not enough to stop infections and must be combined with frequent hand washing, covering sneezes and coughs, and avoiding close contact with anyone with cold or flu-like symptoms: coughing, sneezing, fever. Does COVID-19 affect children? This is a new virus and we do not know enough yet about how it affects children or pregnant women. We know it is possible for people of any age to be infected with the virus, but so far there have been relatively few cases of COVID-19 reported among children. The virus is fatal in rare cases, so far mainly among older people with pre-existing medical conditions. What should I do if my child has symptoms of COVID-19? Seek medical attention, but remember that it's flu season in the Northern Hemisphere, and symptoms of COVID-19 such as cough or fever can be similar to those of the flu, or the common cold, which are a lot more frequent. Continue to follow good hand and respiratory hygiene practices like regular hand washing, and keep your child up to date with vaccinations, so that your child is protected against other viruses and bacteria causing diseases. As with other respiratory infections like the flu, seek care early if you or your child are having symptoms, and try to avoid going to public places, workplace, schools, public transport, to prevent it spreading to others. As of the 1st of March, UNICEF had delivered nearly $1 million worth of supplies including masks, protective gloves, and goggles for health workers in China. UNICEF is working with the World Health Organization, the National Health Commission and other partners to strengthen risk communication so that children, pregnant women and their families know how to prevent the spread of coronavirus. This includes the development of online training modules for health workers, and FAQs and guidance for pregnant women and children. UNICEF is also actively taking steps to provide accurate information about the virus by working with online partners like Facebook, Instagram, LinkedIn and TikTok to make sure that accurate advice is available, as well as taking steps to inform the public when inaccurate information emerges.